Hey guys, Dr. Heimlich here. And one question I hear almost on a daily basis is, why isn't my doctor doing anything for the autoimmune component of my low thyroid condition? I had a lady in here who was pretty upset about it, and she just wouldn't let it go. It was, let's see, it was Thursday. So we're sitting down, we're talking about it, and she's been treating with us for about 6 weeks now, and she's feeling better. She's losing weight, and she's getting her energy back. And, her symptomatology started to get control of her life again, basically. And she came in, and I thought she was going to be really happy because, she told Margie as she's walking down the hall how much weight she's lost and this and that. She sits down. She's like, "Hey, I just got to ask you a question. Why didn't my doctor do anything for this?" I was like, "Well, I guess I kind of blew it off because I hear it so much. It's like, well, I don't know. I guess, I don't know. He just didn't." No, she's no, why? No, why? Why not? And she just kept asking over and over. It's like, man, there's a whole plethora of reasons. And I can't honestly, how do I know? I've got no idea. That's the reason, I'm trying to help as many people out with this as I possibly can. That's why we see a whole lot of these people suffering with low thyroid symptoms. Is because I got tired of telling people, go see your primary, go see the endo, because something's not right. You're not feeling right. This isn't right. You need to get help. And having those patients keep coming back and saying, "Oh yeah, they said everything's all right. Oh, they gave me some medications. Oh, they changed my medication. Oh, they gave me some of this. They took some of that away," and not getting any better. So that's why I decided to, you know, burn the midnight oil, go through the journals, do what it had to be done, go through and get board certified. Um, you know, just do what a doctor should do, essentially. And to get back to the questions, why didn't your doctor do anything for it? There's a couple reasons. Number one, he may not have known, and I think in this case they didn't even test her for Hashimoto's. Um, so that's one reason, ignorance. They didn't know. Number two is they really don't have anything to do once they find it out because, like I've said before, most researchers and textbooks will consider low thyroid patient or hypothyroid patient synonymous with Hashimoto's because it's such a high prevalence, 95% of the time. That's what it's due to. There can be some other causes, but that's 95%. That's pretty much it's almost a lock. So that could be it. They don't know. Or the other thing is they don't know how to treat. They don't treat it any differently. They change your thyroid medications. And the third thing is, I guess I kind of alluded to, like the cat, it's because they haven't done any continuing education to figure out what's going on with it. They don't think there's any ways to help someone out naturally without having the drugs take the front and center stage for it. Because I get that a lot too. Patients will go and they'll be with us for a while and they'll go see their doctor. Doctor walks in the room. "Oh my gosh, Kim, you look fantastic. What have you been doing? You've lost weight. Wow, your hair looks different." And the patient will say, "Yeah, geez, I'm going and seeing this other doctor." Well, what is he giving you? What medication are they giving you? "Oh no, it's not medication. It's lifestyle change. He did some testing to figure out I have an autoimmune condition. He's helping manage that." Well, yeah. Well, what did they give you? "Oh no, it's a natural. I do supplementation. It's a natural." Oh, a natural thing. Mm. And then they kind of foo it as if it's not real, even though 10 seconds earlier, like, oh my gosh, they're totally amazed at the change in that patient. And it's happened time and time again. And I know it sounds like it kind of shakes me a little bit, but I'm glad in a way that it's out there because it pretty much opens a floodgate for people to come into our office and gives us the availability to really help to change their lives for the better. So to get back to the reason why it's not being done is because there's no medication out there that they're able to give for it. If someone has such a really bad autoimmune symptomatology, then they'll throw corticosteroids on there and help to kind of squash down the immune system. But what makes more sense is to balance the immune system to help control it, because if you're on or know anyone who's been on corticosteroids for long periods of time, that can significantly decrease your overall health. So that's why they don't go ahead and do that for the immune component, because they know that it could cause more harm than damage. And there are some extreme cases where they need to use it, but very rarely. So if you're suffering from this type of stuff, autoimmune type of things or low thyroid, go get tested. Go to someone who knows the stuff that we've just talked about and figure out what's going on. And don't get upset with your doctor. I guess some people get really mad and upset. I'm going to go tell them off. That does nothing. That's just a bunch of negative energy there. What you need to do is focus on the positive, focus on figuring out what you need to do, where you need to go to get the help that you need. I'm Dr. Heimlich. Thank you very much.